First responders put their lives on the line every day, and most do it with pride. But the things they see and deal with can leave a mark, one that's not always physical. The mental toll of the job can be drastic. A report from First Help shows an average of 184 officers die by suicide every year. We saw that with a Charlotte-Mecklenburg police officer who took his own life just a couple months after these 4 officers were killed in the line of duty in April of last year. Those tragedies spurred a Charlotte woman to work on building a wellness center specific to the needs of first responders. I spoke with her about her plans and a former officer who says this would have really helped him when he went through his own mental health crisis.
Playing so many roles every single day, it messes a little bit with your psyche for sure. Hank
Sir recalls the 15 years he worked undercover in the Vice and Narcotics Unit with Charlotte-Mecklenburg Police.
This is the first badge that was given to me right out of the academy. I was so proud to have that badge, and my goal was to keep that badge for 30 plus years.
But a terrifying incident in 2016 would cut his career short.
The last thing that was kind of said was, if you kill us, we're going to kill you.
He says a protest in the streets of uptown Charlotte quickly turned into a riot.
All these white police officers going to die.
Hank, who ironically was part of the Civil Emergency Unit with the goals of connecting with protesters and diffusing any violence, describes having to run to his unmarked police car, which was quickly surrounded.
When they started tipping the SUV back and forth to try to flip it while we were in it. And that's when everything right then and there changed for the rest of my life.
He says his partner started having a panic attack, and they prepared for the worst.
I kind of told them, if this is it, I love you, I'll see you again. And so I was convinced at that point, only time in my whole career, I've been through a lot, but mentally I was like, this is, I guess, how I'm gonna go out. This is how I'm gonna die.
They managed to drive off and make it out of that situation safely, but the days that followed for Hank became a new nightmare.
I then started having panic attacks, and I didn't realize it. I'd never been taught what it is, and I ended up feeling like I took 100 Red Bulls through a funnel, and it was just shaking almost all the time.
Over the next several years, Hank went to mental health facilities, took hundreds of prescription drugs, and eventually decided to medically retire.
What I would say is that Hank's story is not rare.
Dee Jones, also a former officer who worked with Hank, now has the goal of helping first responders like him get more honed help locally and immediately.
I've talked to first responders across the state that have reached a crisis point, and they've had to put themselves in facilities that are not here locally, not even in the state of North Carolina. Our goal is to say, okay, this is a specific group of people that need a specialized type of care with understanding behind it.
She's working on raising money for and building a wellness center in North Carolina that would provide 3 main services based on her research of what first responders need most: physical fitness, mental health therapy with peer support, and faith-based care.
Go! It's a good one. It's a good one.
Hank now has his own athletic training company.
Good work.
Enjoys leather work and repairing baseball gloves, and is happily married, but wishes he had received the help he needed sooner.
We always believe that we are the helpers and we don't need help. And it's only years later now that I realize, I'm human, that you can ask for help.
And so this potentially could save lives.
I would say that it already is.
Yeah, Dee and Hank are both just such wonderful people doing great work even after leaving the force. And I just really thank them for being so candid and sharing both of their stories on such an important topic.
Yeah, a lot of first responders have to step in on people's worst day and try to help there. Wow.
Absolutely. They definitely go through a lot themselves. Hank was eventually diagnosed with PTSD along with other anxiety disorders. Now, if you'd like to donate to Dee's Wellness Center, known as the Pulse Renewal Project, we have a link posted on our website, SpectrumLocalNews.com, under the Scene on Spectrum tab. She hopes to raise over $1 million by January to then break ground and start building. And they're still working on finalizing a location in Charlotte.
Yeah, we're going to keep following that, of course. And if you or somebody you know have thoughts of suicide, you can call or text the National Crisis Lifeline at 988.